Hey guys, it's Dr. Diaz again with Momentum Chiropractic and Rehab. We have Michelle here. She's been brought in by Jason. She's seen our videos. She's seen a chiropractor before, and she's now a teacher. But just kind of a little bit of history on her. She's played hockey for 21 years, played collegiately. So she has some issues with pain in her cervical thoracic junction. So the cervical thoracic junction is just a part between the lower cervicals and the upper thoracic spine, upper back. She has some tenderness around both scapula. She also reports some low back pain or some right SI joint pain. So sometimes when she gets up, she feels a big pop and it's painful. She kind of has to readjust or reassess it to get some better movement or to feel like it's back in its appropriate place or position. So as we were palpating, we found definitely the trigger points around the scapula. We noted that she has a little bit of rolled shoulders forward. So we're talking about strengthening these rhomboid muscles, these upper back muscles to help with that forward. Again, we talked a little bit about fixing the cervical curve. So trying to encourage some postural exercises for the neck, because where the neck goes, that's where the shoulders go. So if the neck's forward, the shoulders will go forward. If we fix this here, but we don't fix the neck, this is going to continue back to a forward posture. So we want to correct the neck posture to maintain longevity in a correct spinal posture in the cervical thoracic region. Within the SI joint, we palpated. We have some issues that go down the some of the glute muscles, the piriformis muscle, glute minimus. So far we've done some electronic stimulation. We place the electrodes, little stimulation machine here that we've shown you guys before. We place them around the SI joint, down into the glute. Really quick, what did you feel with that SI joint? With the stem.
Oh, the stem. I can feel the muscles that were getting looser as it was contracting and releasing.
Good. And you've had E-stem before, right?
Yes.
And was it kind of that same intensity?
Mm-hmm.
Okay, good. What about here between the shoulder blades? How did it feel with the electronic stimulation?
I could feel that the muscles were contracting and releasing, and hopefully making some of those knots a little smaller.
Good. So that's a huge thing that she's mentioning, is making those knots a little smaller. So she knows, some of her issues that she has. She kind of knows what she needs. She comes in, we get chiropractic work. So what we're going to use here right now is we're going to show you how we do our adjustments, which you've seen in most of our videos. Just a quick interjection. Like us, follow us on YouTube, follow us on Facebook, Instagram, like our videos, tag your friends, put their name on there. Hey, come check this out. People like our videos on Facebook and they want to see what's going on, see what you're interested in. So we're going to have Jason set up right over here for adjustment, and then you stay right here. I want you to scoot about this much forward on your chair. Relax your shoulders back for me, and we're going to palpate through the neck. Now, when we were palpating earlier, we found more restriction here on the left. Okay, let's try the right side here. Okay, good. We're going to try adjusting through here. Relax here for me. Very good. Okay, good movement. Is that something that you're familiar with?
Mm-hmm.
All right. Okay, relax right here for me. Very good. Okay, let me have you lay right here, face down, right on the table. Does that feel pretty good?
Oh, that was amazing.
All right, good. That's what we like to hear. All right, let me use a little bit of lotion here before we adjust the upper back. Okay, I'm going to get here between the scapula a little bit. Okay. Feel those trigger points in there?
Mm-hmm.
Okay, I like to get a little bit of red response here before we get the adjustment in. Good. Okay. Okay, we're going to get some movement right up here. Relax right here for me. Very good. Right here. Very good. Relax there for me. Take a deep breath for me. Completely exhale. Very good. Take a deep breath for me. Completely exhale. Very good. I'm going to use some lotion down here as well. You okay?
Mm-hmm.
Good. Now, you said you were getting chiropractic adjustments in Pennsylvania, correct? Or
Yes.
about that deep of adjustments?
No.
No? So we're famous on YouTube for a reason, huh?
Uh-huh.
All right, good. could already imagine the comments we're gonna get for that comment. Let me have you lay on your side facing this way for me. All right. Right here. Top leg bent, bottom leg straight. Give me this arm right here. We're gonna set you up for an adjustment here, okay? I'm gonna pop it here through the SI joint. Take a deep breath. Completely exhale. Very good. Lay facing the opposite way for me. Same thing here. Top leg bent, bottom leg straight. Good. Right there. Take a deep breath. Completely exhale. Very good. Lay face up for me. Okay. I'm gonna get some adjustment through the ankles here. Good. Good. Relax right there for me. Actually, let's have you stay right there where you're at.
Okay.
Scoot up just a little bit. That's perfect. Very good. Got that motion in here?
Yeah.
Good. Let me have you lay face down one more time here. We're going to use a little bit of get some soft tissue movement as well with the Makita drill. Mm-hmm. 21 years of hockey. Good. Let's see here. We're going to work on this SI joint here, okay?
Okay.
Very good. All right. We'll have you sit up here. How are you feeling?
Really good.
Really good?
That was awesome.
Nice and loose? How do your muscles feel?
Very loose. My shoulders feel great.
Very
My neck
good.
feels amazing. Thank you so much.
You're welcome. Would you recommend our followers to come see us?
100%.
All right, guys. 703-369-2019. Remember, like our stuff on Facebook, YouTube, Instagram. Share, tag your friends, comment, and we'll see you soon.